Hi guys, welcome once again. Today we'll be talking about complications in sickle cell. Knowing really changes everything. We want our healthcare providers, we want our caregivers, our loved ones, our family, our spouses to know that people with sickle cell disease is at risk from several complications, and if these complications are not well taken care of, they could lead to greater risk, such as organ damage. Today we'll be talking about the common complications in sickle cell. Firstly, I would like to talk about stroke in sickle cell. We've heard about the word stroke, and stroke is even more common in children with sickle cell disease. When there is less oxygen and less blood flow to the brain, it could lead to stroke in children. And from research, it is known that when a child suffers a stroke, there's another 75% chance that she or he will suffer the stroke again. Also, there's something we call acute chest syndrome. Acute chest syndrome. In acute chest syndrome, we have a situation where someone with sickle cell is unable to breathe because of infections or fluids that has clogged up in the lungs. And characteristics of this complication is that a sufferer will have shortness of breath, fever, chest pain in adults, and there are even other symptoms. So when you begin to feel these characteristics, you should see your healthcare provider. These are signs that you have acute chest syndrome. Now, there's another one called spleen sequestration. Yeah, it's a big word. Spleen sequestration. So when large amounts of sickle cells get trapped in the spleen, it may result in a complication called spleen sequestration. People having these complications may tend to have their spleen removed entirely, and this could even lead to a greater risk. Also, we have leg ulcers. In leg ulcers, uh, there is less circulation of blood in the leg blood vessels. So it is mostly common between the ages of 10 and 15, and it is more common in male gender. Uh, you know, People with leg ulcers, when they have a wound, even just a tiny wound, it could lead to something bigger, and it gets bigger and bigger and bigger. Because when you start seeing signs, probably you have a bruise and it wouldn't, it keeps growing bigger, doesn't seem to heal. Please see your doctor. You have to go to the hospital to have all these things checked out. When you start experiencing chest pain, you start experiencing all sorts as a result of this disease, please um, get yourself down to the hospital. Our caregivers, please and please, if you have children, you have words, that suffers from sickle cell disease, the moment they begin to show signs of these complications, please let's get them down to the hospital. Let's not self-medicate them. Also, please and please take care of yourself. If you have sickle cell disease doesn't have you. You could actually, you could scale through. Just try and try. There's another complication, which is pain crisis. We all know about this. This is like the hallmark in sickle cell disease. Very common, and it could last for hours. In some people it could last for weeks, it could last for days, depending. But please, immediately you start experiencing pain, pains that even medications is not helping, you need to get yourself to the hospital, please. Let's let's help ourselves, and then let's help people with this disease. Let them understand that yes, we really really understand what you're going through, and we can go through it together. Please, no discrimination. Let's talk about sickle cell. Let us stop. Let's reduce the stigma. Thank you once again. You can see my makeup is on fleek today. Uh, so next week we'll take more complications. And guess what? My YouTube channel is out, Adebanjo Ibukunjeso. So you might want to check out our videos. You might want to watch our videos. And please subscribe to my channel, Adebanjo Ibukunjeso, creating awareness for sickle cell. It's all about sickle cell advocacy. Thank you for today. Thank you for listening. I hope the information has actually helped. I'll see you next week. Stay tuned. Bye.